that so I don't forget. So, all right, I think maybe we can start to get started. I just wanted to thank everybody for agreeing to help out with the ACI Alliance on the Hill. Doing it virtually is going to be different, but I think we're all used to Zoom at this point, so that is certainly not new, which is easy for us. And we cannot thank Powers enough, especially Emily, who is doing a lot of the hands-on arranging of all of the meetings. And we are joined tonight by Peter and Michaela, who have been incredible helps as well. So I am going to hand it over to Peter to get started. And I think if there are any questions, Peter, would you prefer them to wait till you're over or to ask them while you're presenting?
No, I think we're relatively informal. Happy to take questions as they come about.
Perfect.
And I will be presenting tonight with Michaela. We're going to split the slides.
Great.
I'm going to do a lot of the kind of the issue areas, and she's going to handle a fair amount of the logistics and some of the other material slides and things of that nature. Would you like to begin?
Take it away, you guys.
Okay. Well, welcome to the preparation session, one of the two preparation sessions for the ACI Alliance virtual congressional fly-in. It's going to be held on May 4th. There are some important times and dates that we want to familiarize you with, and we'll get to that in the slides. My name is Peter Thomas. I'm with Powers Law Firm. Powers is a Washington-based law firm that focuses on healthcare. And ultimately, we've represented and worked with the American Cochlear Implant Alliance for several years now. This is our, I'm not sure, Donna, which one this is, but several, we've held over the years several fly-ins, similar events like this, where we try to get as many people involved in the ACI Alliance to communicate with Capitol Hill, go visit their legislators, whether they're members of Congress or senators or their staffs, and to try to build relationships with the policymakers who are responsible for really making the policy that affects coverage, coding, payments, availability of cochlear implantation, and all that comes with that in a variety of payers. Medicare is the huge payer, but there's Medicaid issues we work on, and other payers as well, of course. We've identified 3 goals this year. We like to try to keep it to no more than 3. And we will talk a little bit more about what these meetings will really feel and look like in a moment. But what's the purpose of this? The purpose is really to do 2 things: to amplify our voice and to bring our voice to Capitol Hill, and to continue to build on some of the relationships that we've started in the past, and to develop new relationships with Capitol Hill staff and members of Congress. There is a lot of turnover on Capitol Hill, not only within the ranks of the elected officials, but also their staff. So it's a constant battle to build these relationships and keep current with who's up there and who's making these decisions. But it's an important aspect of advocacy, because it's really a way not only to try to get legislation through, and we'll go through some of the examples of that tonight, but also a way to build support and put pressure on federal agencies that have a lot to do with coverage and availability and access to cochlear implants. And we'll go through that as well. The 3 key issues we plan on discussing tonight will be the promotion of a proposal that sits right now at the Medicare program, what they call CMS, the Centers for Medicare and Medicaid Services, where they're considering expanding coverage for cochlear implants. We're going to go into that in depth. The second issue we'll talk about with legislators on May 4th is a reauthorization of the Early Hearing Detection and Intervention Act. That's known as S4052. That's Senate Bill 4052. Again, we'll go into much more depth in a moment. And then the third issue will be trying to secure permanent reimbursement for telehealth services, telerehab services, particularly for speech language pathologists and audiologists, to provide services through telehealth to primarily, in our case, the CI population. Again, building relationships, this is a key thing that we want to continue, and that's one of the key reasons for the fly-in. Michaela, you are going to handle the next couple of slides, so why don't you begin?
Hello, everyone. I'm Michaela. I tend to help Peter with all the comings and goings of powers and keep track of kind of the comings and goings of Washington. So I'm just going to run through a couple key times and dates real quick. Obviously, today we're having our first training session. Our second training session will take place on Monday, May 2nd. That will just be a recording of today's session. So in case you want to go back and review some of this material, you'll have a chance to do that. Also, anybody who's not on this call will have a chance to review the material. The morning prep session, so on Wednesday, May 4th, we'll have a prep session starting at 9 a.m. We'll just kind of review the talking points once more, make sure you guys are all comfortable and ready to have a full day of meetings. And then again, on Wednesday, May 4th is the virtual Hill Day and Fly-In. The meetings tend to take place between 10 and 4. I can guarantee that most of you won't be going to 4. I looked at the schedule earlier today, but your meetings will be taking place somewhere in between the 10 a.m. and 4 p.m. time.
So, Michaela, let me just mention that while it's important for you to block off that time period, I know that's difficult. That's 6 hours. I would not expect, you will not be on the phone, you will not be on Zoom for 6 straight hours. That's just not going to happen. You will have plenty of time in between meetings and throughout the course of that time period to do other things. The problem is that you won't necessarily be able to plan for it because the schedule is still being worked on. And frankly, the way this goes with Capitol Hill being as busy as they are, changes occur all the way up to the time when we send this out. We'll probably send this out just the day before and probably refresh it the morning of. So if you can block off that time on your calendar, we greatly appreciate it. But again, there'll be plenty of time throughout the day to do other things, return emails, do impromptu meetings with people, make telephone calls, whatever you need to do.
One other thing is, we'll get into this a little bit later, but even though the meetings are blocked off in 30-minute time frames, they normally only last 15 to 20 minutes. So you'll normally have time to go to the bathroom, get a cup of coffee, answer emails in between. So it's like Peter said, it's not a 6-hour thing. I'm just going to go over some logistics for Zoom. Obviously, you guys know how to use Zoom since you're on here tonight, but just so you guys are aware for day of. Emily will be sending out Zoom invitations, so your name will be on them as well as the staffer name and your either Powers or ACI Alliance group leaders and the rest of your teammates. So this Zoom link, you'll just click when it's time for your meeting, you'll just click on the link in the calendar invite and it'll take you right to the staffer office where you'll have your meeting. You'll receive a calendar notice for each call, so make sure you monitor those in your inbox and make sure they are all on your calendar for the day of. One key thing is all the materials that you'll need for the meeting are all going to be on that calendar invite already, so you don't have to worry about memorizing anything. And during the meeting, you can just tell the staffer to refer to the meeting materials in the calendar invite. In my previous experience, they really enjoy having those in the calendar invite because when it comes a week down the line or even the next day after the meeting, they know exactly where the materials are and where they can refer back to them for information, either to tell their boss or to discuss their issue with other staffers. As Peter mentioned, things move very quickly on the Hill and schedules can change at the drop of the hat. And that's not due to lack of planning. That's just because that's just the way Capitol Hill works. If you have any issues connecting day of during the meetings, feel free to reach out to me or Emily, who's scheduling all the meetings, and she'll be able to tell you if the staff removed the time or if the Zoom link is wrong or whatever goes wrong. I don't not anticipate anything going wrong, but I wanted you guys to have this email just in case something changes and you need to contact her. Obviously you all have a Zoom account already, but if you'd like to create one, you can. One thing caveat that I wanted to mention, we have respectfully asked all Hill staffers to join the meeting with video. Unfortunately, we don't have much control over that. I do know that there are certain Hill offices that will be joining audio only, but for those offices, we'll be sure to take good notes and follow up with them if there are any difficulties. But if they come on, I would preface to say, you know, it would be nice to do video, but if they don't join via video, it's not a big deal. We can follow up with them later. All righty. So each person you're meeting with during the fly-in were targeted based on several aspects. One being if they were held membership on a committee of jurisdiction. So any of the committees that handle healthcare or the hearing, early detection reauthorization. So in the House, that would be Ways and Means, which takes care of taxes and most importantly for us, Medicare and Medicaid programs. And they deal with anything CMS related. And then Energy and Commerce is the other key health committee in the House. And they deal with everything that Ways and Means doesn't deal with. So in this case, the hearing, primary care providers, detection, cancer, you name it, that's what Energy and Commerce deals with. In the Senate, that would be Finance. Finance is basically the Senate equivalent of Ways and Means. They deal with taxes and most importantly for us, CMS, so Medicare and Medicaid. And Health, Labor, Education, and Pensions is basically the equivalent to Energy and Commerce, and they deal with everything else health related. So they are targets for our the early detection and intervention reauthorization. The second reason we targeted these people are the cochlear implant and hearing health champions. So this is kind of where Peter mentioned earlier before, where keeping uphill contacts is very important. So these are people that we have pre-identified as Hill champions and people that we can count on to kind of come back to for cochlear implant issues, or if there's something we are concerned about. These are the people that we've identified that will support the Alliance and everything that we're moving towards. Third is ACI Alliance members constituency. So basically we have targeted your representatives and your senators. So for instance, I know we have Michigan people and Kentucky people. Because you are constituents, you are a very important voice on the Hill. Your members of Congress want to hear from you. That includes senators and representatives. They love meeting with their constituents. They love hearing about the stories that impact you. So many of you are in meetings with your senators and representatives, and you'll notice that when you receive the schedules. But if you do belong to the state or district where the meeting is in, I recommend you lead that meeting. And when I say lead, don't worry, this is a group effort. I just mean you kick off and say, hey, I work in your district, or hey, I work at this hospital in your state, and these are the issues I deal with, and these are the clients that I see.
Okay, thank you. Thank you, Michaela. What I want to do now is take a pause and ask for questions, because we're about to go into the part of the presentation that starts talking about the specific 3 issues that we're going to be dealing with and talking about with Capitol Hill. So let me sit back for a second and just recap a few things that Michaela said and then ask if there are some questions. The morning of this event, there will be, as Michaela said, a last minute prep session. So if you feel you've got a question or two, or you just don't feel confident about a particular issue, talking about a particular issue, or you got any kind of question that you'd like, or just want a refresher to orient your mind before you embark on this experience. And some of you have done this before, some of you are brand new to it. Please participate in that. It'll be kind of the opening of the fly-in. If we were in town, it would be our breakfast meeting when we get together and discuss this and have breakfast and meet your group and get ready to travel to Capitol Hill. We're doing this all virtually, of course. So this is our virtual opportunity to just make sure we're all ready to go before we get on the first meeting with a Hill staffer. I would recommend that you try to get on the Zoom calls, on each Zoom call, and of course, each meeting you have will be separately loaded into your computer, onto your calendar, assuming your calendar is connected to your email, and I think most people's are. You'll be clicking on a separate link for each Zoom call. You'll come on to the Zoom call, you'll see a few other people. You're not going to be alone. You're not going to be left to do this on your own or deal with it by yourself. There'll be a team leader that will be on each of the phone calls to try to act as an MC, really, to be kind of a master of ceremonies, say hello to the staffer, ask the members of the ACI Alliance to introduce themselves. Probably even signal them to go ahead and make their introduction by name. And I would recommend saying what you do, as Michaela just kind of walk through what you do, where you practice, who you are, what role do you play in cochlear implantation? That's important. And again, as Michaela mentioned, the person to lead the issues and talk about these issues will be the constituent. Let's say you've got a couple of people from Kentucky and a couple of people from Michigan in the same meeting, but it's a Michigan meeting. You definitely want to lead with the Michigan constituents talking during that meeting and try to build that relationship, that local relationship. I think it's important to note a few things. Number one, sometimes the staffer won't get on the video. They'll just call in, but we have specifically requested they use the video link to facilitate communication. I think it's important not to mention anything about fundraising, or you attended a fundraiser, or you support a particular candidate politically, or you're a Democrat, or you're a Republican, or an independent. None of those political issues matter. This is all about public policy. It's all about what's in the interests of CI patients and the providers who serve them. So please don't say anything related to the politics of anything, really, even the politics of the day. Even if, President Biden makes a huge gaffe and, President Trump or former President Trump says something bizarre, we don't want to go there. We just want to stick to the policy issues. We'll move through the 3 issues. We'll make our requests and we'll wrap up the call. We have another slide at the end of this presentation that will go through some of this a little bit more in depth, but we'll follow up with a thank you, and we'll talk about that in a moment. And that'll be the end of that. Whatever we learned from that meeting, the Washington staff, Donna, Nicole, and then the firm, our firm will have a few people involved in this fly-in. We'll take that information and try to do whatever we can with it to advance the ball and follow up if there are things that we need to do. So any questions at all? You want to just kick it open to any questions that people might have?
Peter, can you confirm that we will be discussing all 3 issues at every meeting?
I think that's an assumption we should make. I think we should try to talk about all 3 issues. Now, let's say you get into a meeting and your team leader says, this person is particularly important on the EHDI bill. Well, you may want to take the EHDI bill and talk about that first. And maybe you spend 15, 20 minutes talking about the importance of the EHDI bill. I doubt that will happen, but if that were to occur, then the other 2 issues you try to get to, but you obviously pull back on the amount of time you spend talking about it. A couple of minutes here on each one, refer them to the one-pagers in their calendar invitation, and you move on. You certainly don't want to go beyond 30 minutes. You want to respect everyone's time. And in particular with these Zoom links, we really have to get off the phone within 30 minutes. But they're going to expect to be off the phone in 30 minutes anyway, so that's not a big deal. So play it by ear a little bit, but yeah, generally you'll be talking about each one of the issues in every meeting that you're in. The last thing I'd say is don't hesitate. When you do this, you'll make some arguments and you'll make some statements about the issue that we're talking about. just because you're on in the next meeting, the next hour and the next hour, the same group of ACI Alliance people, but different Hill staffers, don't feel you need to state what you've said differently. You can repeat exactly what you've said in the way you said it, assuming it was persuasive and it was accurate and it was well done. Don't feel you need to reinvent the wheel each meeting. We just need to convey the information to each person in the most effective way. Barbara, can I take a question from you?
Yeah, I'm just thinking about 20 minutes and 3 topics. And I guess my experience has been that many people have no idea what a cochlear implant is. And so I want to be sure that I'm assuming in the notes and guidance, you've given us some talking points about that, but people often get really just interested in what the device is and how it works. And that's important, but it's sometimes I'm just trying to figure out how you get all that and these key issues. I wonder if you thought that through.
Well, it's interesting. We do these fly-ins a fair amount. We just did one yesterday. I had 11 meetings, virtual meetings yesterday for another client. And the same exact situation with them. We spent a couple of minutes talking about what the client was all about and who they were and who they treated, and then went into their 3 issues, and it works pretty well. I think we'll be able to get through it. And by the way, we found that the level of understanding and awareness of cochlear implants is growing significantly over the years. When we first started doing this, it was a lot more hit or miss as to whether someone would really know what that is. More recently, we really have noted the awareness level of cochlear implants is vastly outstrips where it used to be. So certainly a good question to ask to start the meeting off is, can you tell me how much you know about cochlear implants? I'm happy to discuss a little bit of background to give you just an elevator speech on that. And if they say, sure, I'd appreciate that. Just bring me up to speed, quickly kind of go through it and lay it out in a few minutes, and then we'll move on to the issues.
Peter, I see that Kate has a question in the chat, which is about what if something unforeseen happens day of and we can't participate?
Well, the good thing about doing this in a small group, there's a group of you in each one of the meetings, is that we won't be standing anyone up. It would not be a good thing if we scheduled a meeting with a Hill staffer and no one appeared. That would not be a good thing. So for sure, please let Emily Goodwin know, and that email address is on the slide deck, and we can put it in the chat as well. Maybe you could put that in the chat. Emily is the assistant to the legislative practice, and she pulls together a lot of these schedules and makes these meeting requests with our assistants, and does a great job in coordinating this. So if you do have an unforeseen conflict, whether it's for one meeting or the entire day or whatever it might be, just let us know, let Emily know as soon as possible, and we'll try to make sure that other people are covering those meetings. Any other questions about kind of the overall, how you do this? We're going to get into it a little bit more, but I wanted to move on to the actual issue areas we're going to be talking about. Okay, let's move on. So remember, you're on the phone for a reason. You're participating in this fly-in for a reason. The team leader is not intended to do all the talking. The team leader is intended to facilitate you doing the talking, especially if you're there and that's your congressman or your senator who is on the phone or their staff. And let's be honest, much more than likely it's going to be staff. There may be in some instances where the member gets on the phone, but more than likely you're going to be talking to staff. And don't be alarmed if the staffer looks like your son or daughter in terms of their age. There are a whole lot of 20-somethings on Capitol Hill. And believe it or not, they kind of run the show up there. They do a lot of the heavy lifting, burn a lot of midnight oil, and are critical to the process. So they're going to be very, very important that we don't assume just because they're young that they're not important. Typically, they're very plugged in. They meet with the congressman or senator on a routine basis, and they work these issues up the chain of command. Let me begin by saying it might be a good idea once you get your kind of group, and there might be some transition from one group to another between meetings and such. It's a good idea if you know the NCD, the expansion of coverage, like the back of your hand, but you're not all that familiar with the EHDI legislation or with telehealth, you should be focusing on the NCD discussion. It goes without saying. If you really know telehealth and you've got it down and you're using telehealth and you've got an example you can show or demonstrate how important it is, you should be talking about telehealth. And don't hesitate to weigh in, excuse me, to weigh in on each one of the issues. But if you feel it's been covered by the other people, then there's no reason for every single person to speak about every issue. So let's get started. The first issue that the ACI Alliance is bringing to Capitol Hill is a pending Medicare request to expand coverage of cochlear implants for Medicare beneficiaries. Now, why is this important? Number one, right now, Medicare beneficiaries do not have the same access that the FDA would allow people to have. In other words, the FDA criteria are more generous than CMS policy for covering Medicare patients who could benefit from cochlear implants, but don't, because the Medicare coverage policy prohibits them from doing so. So this is an important issue. The issue is pending before CMS. It's pending at the federal agency. And you may recall that ACI Alliance just conducted a major campaign during the month of March to get as many comment letters submitted to the agency to make sure that the agency heard from as many people as possible about the importance of expanding coverage for cochlear implants. This was a formal written request that was submitted quite some time ago, I might add. There was a clinical trial or a large-scale test that was done with CMS. They were partners with the CI field. And we are now at the point in the process where CMS has opened up this request for a national coverage determination expansion. They've gathered public comment, and now they are making their decision over the next few months about what to do with respect to this coverage policy. The goal that we have with Capitol Hill is to go to Congress and to get a letter, a sign-on letter from congressmen and congresswomen to CMS that supports this coverage expansion. So let me talk a little bit more about what the slide says here. The letter that we have is being sponsored and kind of led by two representatives. One is Representative McKinley. He's a Republican from West Virginia. And the other is Representative Thompson, and he is a Democrat from California. These two representatives in the House are the co-chairs of the House Hearing Health Caucus. And so they lead a subgroup or a caucus of House members who are interested in hearing health. And they have agreed to put forward a joint letter, a bipartisan letter that would be submitted, sent around in what they call a Dear Colleague letter. They're going to write a letter to their colleagues and say, please join us in signing this letter. And we are going to take this letter around to Capitol Hill and go to as many offices as we can and try to get as many of those offices to sign on to this letter. So in the end, we'd have 20, 30, 40 signatures at the bottom of this letter, and they would send it to CMS in support of this national coverage determination expansion. So that's job one. That's the goal that we have. And it's each person's responsibility on the phone to try to get the member offices that they meet with to sign on to this letter. Now, this is a House letter. Typically, senators don't sign on to House letters. And typically, House members don't sign on to Senate sign-on letters. We don't have a companion Senate letter for sign-ons. And there's some reasons for that. Number one, there's not a hearing health task force or caucus in the Senate. It's more difficult to identify champions on this issue. Number two, Senate offices just don't like doing this as much. The House is much more apt to send these kinds of letters than the Senate is. But if you're meeting with a Senate office, we certainly want you to alert them and educate them about the pending NCD and about the need to convey support for it, and show them the House letter and tell them what we're doing in the House. And the request with Senate offices is, please consider contacting CMS yourself on behalf of the senator, or please consider sending your own letter. And here's a draft to CMS that would express support for the senator that you're meeting with. So that's the ask in the Senate. The request in the House is, please sign on to this existing letter that you'll have in the calendar invite in your packets that Congressman McKinley and Thompson are sponsoring. Those are the requests for this. Now, what does the NCD do? It would expand coverage to people who who essentially take hearing exams, hearing tests, and score at 60% or less. Right now, Medicare coverage is limited to 40% or less. And so it's more restrictive than it could be. This would expand coverage to a new segment of the hearing loss community and would be a very positive, positive step forward. So again, the public comment period that was opened up in March is now closed, but that doesn't mean that members of Congress can't continue to impact the agency. Members of Congress can send letters to CMS whenever they want, and they'll be duly considered. So this is very much a viable issue. It's perfect timing. When we put on, and chose this date last year for the fly-in, we had no idea that the NCD would be in the middle of being considered. So this is a great, the stars are aligning. This is a great opportunity for us to really press the case and hit home why it's important to move from 40% to 60% in terms of Medicare coverage for Medicare beneficiaries. That's pretty much this issue. It's relatively straightforward. We want to educate the office about CI coverage policy, talk about the expansion that's pending. It's clearly an evidence-based expansion, and we want them to weigh in and show their signs of support. In the House, sign on to the sign-on letter. In the Senate, express however you wish to express to CMS our support for this, whether they give them a call or whether they send their own letter using the House sign-on letter as a template or a draft. Any questions or comments, or Donna or Michaela, would you like to mention anything about that issue?
I have a question about the mechanics of signing the letter. Will we actually want to get their signature during the call, ask them to print out the letter and sign it, or what are the actual mechanics of signing the letter while we're meeting with them?
Yeah, it's a great question. We tend to gloss over those things that sound obvious to us because we do this all the time, but frankly, it's a great question. No, you're there to expose them to the existence of the letter. Now, remember that McKinley and Thompson will have already sent out a Dear Colleague letter to their colleagues. There's, in addition to those two, there's total 435 members of the House. So they'll be sending out this letter along with what they call a Dear Colleague letter saying, Dear Colleague, I'm sending this letter to CMS on expansion of CI coverage. I'd like you to join me in signing it. Please let my staff know by X date, whether you can sign on. That sits out there for a few weeks or however long it sits out there. And the staff takes this letter, runs it up the chain of command. If they want to sign on, if that office wants to sign on, they will electronically arrange for the congressman's signature to be sent to the staffer with McKinley or Thompson. Democrats will send their signatures to Thompson. Republicans will send their signatures to McKinley. They'll put them all together in one final letter. and they'll send it over to CMS. So all we're really doing is exposing them to the letter, the existence of the letter, telling them about the issue, encouraging them to sign on.
The only other thing I would add is they'll have access to the letter. Like I previously mentioned, the letter will be in the calendar invite. So a lot of times while you're talking to them, they'll actually go to the calendar invite and pull up the letter and briefly look over it so they can review the language and then send it up the chain like Peter mentioned.
Something you might add during those conversations about the NCD is just to talk about the frustrations that we've had in the CI community with Medicare beneficiaries who have to wait before they can get a cochlear implant, and what that means in terms of how well they're going to do overall, and the issues that we now have associated with cognitive health and hearing loss, and how, you know, these people are going to at some point be candidates, but they're having now to wait so much longer to be able to hear, be able to go about their lives, get out of the house, et cetera. So use some patient stories here, not too much because we want to get through all the issues. But I think an anecdote about one or more of your patients would really be meaningful. And that's essentially what we did when we met with CMS. We took Lou with us, Lou Ferrigno, the Incredible Hulk, and we met with CMS a few weeks ago. And he basically told his story, and it was very compelling and impactful. So I think you can have that same effect on these staffers in terms of having them understand why it's bad to wait, why it's bad to leave the candidacy criteria where they are right now, and they haven't been changed in 20 some years. That they've just been sitting, and the field has moved forward and Medicare hasn't moved with it.
It's a great point, Donna. And if anyone knows the evidence base, if anyone can talk about that, certainly your own experience. Those are the kinds of, especially the patient anecdotes, those are the kinds of things that people tend to remember. If you want to cite the fact that Lou Ferrigno got a cochlear implant at age 69 and was on the phone with CMS a few weeks ago with us, that's fine to do that. These staffers are going to be seeing several other people in the same day. They have incredibly busy schedules. Our goal is to, at the end of the day, for them to go home and tell their significant other about this meeting, is for them to remember this meeting. So whatever you can do to impress upon them how important this coverage is and how important cochlear implants are, the better. I'd also say that this is Medicare coverage, but as Medicare, so goes private insurance. So this really does have the potential to impact so many private payers in terms of what they cover and what Medicaid covers as well, what the VA covers. So yes, it's just one payer, but it's the biggest payer in the country. And it does set an example for many other payers. So this could have a real viral effect on expanding coverage for CI.
Barbara, did you have a question?
Yeah, I'm fairly ignorant about this process, but I was wondering, so who makes the decision at CMS, and what does that process look like, and what role do these letters have? I'm just a little unclear about who the decision maker or makers actually are.
I can see Donna smiling because she sent around an article that the ACI Alliance put out earlier this month, or March, excuse me, Donna, that talks about the process and how the decision is actually made at CMS. So we'll definitely send that around to get you a broader idea of who makes the decision and how the process goes.
Thanks. Sorry, I missed that one.
Oh,
No. Let me also say, though, that there is a subgroup within the Centers for Medicare and Medicaid called the Center for Clinical Standards and Quality. And that is where the chief medical officer resides. It's also where a subgroup known as the Coverage and Analysis Group is housed. And they are comprised of physicians and other healthcare experts and government bureaucrats who understand regulation. And they're the ones that look at the evidence and consider the evidence base and decide whether or not to recommend an expansion of coverage. That goes up the chain of command all the way up to the administrator, which is who this letter will be addressed to. Administrator Chiquita Brooks LaSure is her name. And it probably also goes up, I know it does, it goes up to the Secretary of Health and Human Services, Xavier Becerra. If it's very political, like the Alzheimer's drug that you may have read about over the past year, it may wind up going to the White House. It may wind up going to the Office of Management and Budget. But ultimately, this is basically a medical decision. It's not, there are politics involved with everything, but it's at its core, it's a medical decision. Is the evidence there to cover this and to expand this coverage for CI?
Thanks.
And, oh, go ahead, sorry.
No, I just said thanks.
Oh, I was also going to answer the second half of your question, which is what weight does a sign-on letter actually have with CMS? More than you would think. It basically signals to CMS that there are people on the Hill that recommend this and agree with the clinicians and the people who are advising them, which essentially is you. You're taking your stories to them and saying, this is what I see, this is what I recommend. So a sign-on letter does have weight when it comes to CMS and these kinds of decisions.
Okay, I think we can move on to the next issue. And that is EHDI reauthorization. This is the Early Hearing Detection and Intervention Act, S4052. It was just introduced in the Senate a few weeks ago on April 7th. And the one pager that we put out has some additional detail in it. It was referred to the HELP Committee, as Michaela described earlier, the Health, Education, Labor, and Pensions Committee, or HELP Committee in the Senate. They must review the bill and mark the bill up. That's a formal legislative process where they hold a hearing and they consider the bill, and members of the committee offer amendments. And oftentimes a lot of this gets done behind the scenes, and they'll mark up a number of bills at once in one hearing, one markup session. But ultimately they'll mark up the bill and they'll send it on to the Senate floor for passage. The House already passed their EHDI reauthorization bill. Now remember that what is reauthorization? Well, EHDI was passed about 21 years ago, originally enacted, and really did a major service to a huge increase in the number of infants that were being screened for hearing loss and a whole host of other things. That bill had as many of these bills do, kind of a timeline to it, where it would expire after a certain period of time, and it needs to be reauthorized. So it's a little bit unclear because frankly, many bills that don't get reauthorized, those programs just don't go away. There's a whole separate process to this. It's called appropriations, which the Senate and the House agree to fund various programs. And even without a reauthorized bill, you can continue to have EHDI requirements and such, but that's a kind of a footnote. The fact is, we're trying to get the EHDI bill reauthorized. Again, the House has already passed it. The Senate, it's pending. The legislation's been introduced. It's introduced. It's a bipartisan bill. It's been introduced by Rob Portman, who is a senator from Ohio. He happens to be retiring at the end of this year. It's also introduced by Maggie Hassan, from a Democrat from New Hampshire, Bill Cassidy, who is a physician from Louisiana, a Republican from Louisiana, and John Hickenlooper, who is a Democrat from Colorado. So it's got some good bipartisan support. It's not a controversial bill. It's been on the books for 20 years, and I do expect eventually the bill to pass, but it's got to work its way through the legislative process. So we want to add to the voices that are saying pass this bill now, get this thing done. We think it's something that could move this year. There's no reason why it shouldn't. It's already passed the House, as I said. So the bill would continue to support hearing detection programs, increase authorization levels for funding for the programs within the bill. And it would also do something that ACI Alliance actually played a role in getting included in the bill. In the House Energy and Commerce Committee last year, Taryn Kocher, who's one of Power's employees and was on maternity leave, is just getting back, but she helped orchestrate, along with Donna and Nicole, an amendment to the bill that would, in the end, that would lead to a GAO report of how EHDI programs are utilized by parents. And the language itself that we were able to get inserted by Doris Matsui, who is a Congresswoman, Democrat on the Energy and Commerce Committee, essentially would lead to, we think, more significant understanding by parents of the opportunities for CI coverage, and making sure that unbiased information is shared with parents and families when they're being exposed to this. They've got an infant or a child with hearing loss and they're learning their options. We think that this GAO language is going to help. We don't necessarily have to go into the details of that, but I would say that this is important legislation, and it's legislation ACI Alliance has endorsed and supports. The Senate bill is very similar to the House bill, and we want to meet with as many Senate offices and encourage them to pass the bill as expeditiously as possible, and meet with as many House offices and thank them for passing the bill in December, this past December, and urge them to do as much as they can to get this across the finish line this year. What has to happen is the Senate needs to act, and then what they do is reconcile the two bills, the House and Senate bills, into one version. They do that behind the scenes. They typically do it behind the scenes. Sometimes they'll hold what they call a conference committee, but either way, they'll reconcile the two drafts and they'll pass the same exact identical bill again in the House and Senate. At that point, it goes to the president's desk for signature. Once it's signed, it's called an enacted bill. It's enacted and that becomes law. So there's a few steps in that process. We think we're in pretty good shape. It passed in the House by a nice margin. It's bipartisan. People generally support it. It's not a controversial bill. And if people don't really know what it is or remember what this bill is all about, I would recommend that you simply remind them that this is the bill that that got so many infants. I think 98% of newborns are screened for hearing. This is the bill that established that. There's a number of other programs under the bill, but that will give people a sense for what this bill is all about. Any questions on the EHDI bill? So again, your team leader will help if you kind of forget, wait a minute, is it the House we need to pass it in or the Senate we need to pass it? Your team leader will help you with those things. So I wouldn't get too caught up in the different messages to the House and Senate. That's just the way this goes. They're two different bodies. You've got to get them through the two different bodies in order to move this along to the next step. Can we move to the third issue?
This is the third issue.
Oh, yeah, I see that. Sorry.
No, you're good.
Okay, so the third issue is telehealth and telerehab, really. The request is to make speech pathologists, speech language pathologists and audiologists permanent Medicare telehealth providers, and to cover these services under the Medicare program going forward. As you may know, I'm sure many of you do, the public health emergency under the COVID-19 public health emergency designation, ultimately CMS allowed additional providers to provide care through telehealth to try to reduce the rates of transmission of the virus. Once that public health emergency is lifted, unless Congress acts or unless CMS acts to modify telehealth, those public health emergency waivers and that allowed so many speech language pathologists and audiologists to provide care through a telehealth model will go away. We think the public health emergency will be lifted as soon as July. It's been reauthorized and extended by 3-month increments for some time now. If not July, it may be October. If not October, it may be January. But at some point, the federal government is going to lift the public health emergency. And when that happens, what we would like Congress to do is make sure that they extend telehealth coverage for rehabilitation services that are relevant to CI recipients indefinitely, permanently. We want to talk about how important telehealth has been during the PHE. We want to talk about how this will go away unless Congress acts. And we want to talk about the real benefits to patients and in terms of the remote access to their doctors, audiologists, speech therapists, in really being able to access those providers after CI implantation and really getting proficient at both hearing and speech through this process. I don't think we have to get much more complicated than that. There are probably 50 telehealth bills that have been introduced in the House and Senate. We have not specifically chosen to endorse one or the other or press for one over the other. Congress will have to work this out. The good thing about this issue is that every healthcare provider that goes to Capitol Hill these days is talking about the need to expand and extend telehealth. I think it's going to become, if it hasn't already, it's essentially an important component of healthcare at this point. We don't want to be in a situation where telehealth supplants in-person care when in-person care is necessary or even desirable by the provider or the patient. But it certainly is another tool in the toolbox to improve healthcare and to improve access to rehab and telehealth services, whether or not there's a pandemic taking place. So we generally want to talk about the issue and the value of telehealth and how it impacts cochlear implant patients and providers, and encourage encourage Congress to pass laws that will ultimately extend this coverage going forward. Anyone want to talk about this one? Michaela, any additional comments? Anyone have questions?
Hi, Barbara.
This is one of my my babies. I think there are two other things to consider as we're encouraging them to find some telehealth bill to support. And one of the key issues is pay parity. So what is very important for practitioners is that the reimbursement be equivalent to an in-person visit. So pay parity is something state by state that's often come up as a major issue. And the other is that in many cases, in many states right now that do have telehealth legislation, it was originally sort of written in a way that there has to be an on-site in-person practitioner working with that remote practitioner. And that's a very old model, and it may make sense in some medical situations, but it's not necessary. It's not something that we want sort of included as a requirement in a telehealth bill.
Those are two great points. Let me talk about pay parity for a moment. You may get some pushback on pay parity on the Hill, depends on who you're speaking with, what office you're talking with. But here's a couple of arguments for why there should be pay parity. And what I mean by that is, just to put a finer point on it, an in-person visit to a speech language pathologist or an audiologist versus, and the amount of reimbursement under the Medicare program, what we're saying is that pay parity would mean that that provider would receive the same amount of reimbursement if they did the visit through telehealth. There are some questions about whether CMS should pay less for an audio only visit or a video and audio visit as opposed to an in-person visit. Some people assert that because it's not in person, you don't need to clean the room. You don't need to have the expenses of walking the patient back into the audiologist's room. You don't need to have the same cost structure as you would if you were providing in-person services. The problem and the fallacy with that thinking and that argument is that, very few, if any, providers have moved to a 100% telehealth model. They still have offices, they have rent, they still have employees they keep employed, they still have records they need to file and keep for patients. They still have cleaning, and in fact, under COVID, even more extensive cleaning costs and requirements in order to make sure that they depress the risk of infection. So there really aren't many efficiencies to providing telehealth when it's offered as an adjunct or an alternative service to an in-person setting of care. And that's a reason why Medicare should continue to pay the same amount for the telehealth visit as it would pay for an in-person visit. Barbara, do I have my arguments in check?
Yeah, that's good. One other thing is that there are more expenses related to making sure the technology works and that patients have good access to the technology.
It's a great point. Telehealth itself is an expense in and of itself.
Right.
And I would add to that, I know we're running out of time, but the Hill is very aware that broadband is a significant access issue. So that is something that you wouldn't have to necessarily point out, but say, just so you're aware, the Hill is very aware that broadband and access to telehealth itself is very much a problem. All right, we are running out of time, and Peter already went over some of this. So I think I'm actually going to save this for the morning of, because Peter already went through this. Just to highlight, there'll be introductions. Hi, my name is, I work with these people under this provider, under this system. This is what I do. And then we'll lead into purpose, what you're talking about. One thing that I wanted to emphasize is make sure that when you're discussing the issues, make sure you transition so the Hill staff is very clear that you're moving to the second issue. So for example, you can say the first issue we're here to discuss, and then we're going to say the second issue we're here to discuss, and then the third issue here to discuss. I've been in several meetings where those lines are sometimes crossed, and it makes it harder for the Hill staff to try to track what's being said. And then you'll just thank them for their time, and then we Powers and the ACI Alliance will follow up later. Some meeting materials I mentioned earlier. All this will be in the calendar invite, the congressional sign-on letter that McKinley and Thompson drafted, the reauthorization one-pager for the early detection hearing, yes. And then we have the telehealth permanency one-pager, as well as, Barbara, the ACI Alliance National Coverage Determination article that I previously mentioned that Donna published after we met with CMS and Luke right now. So I'll make sure all that is given to you guys so you have time to review it before the meetings, and that will all also be linked in the calendar invites for the Hill staffers.
Donna, let me just quickly interrupt. Last time we did this, I think we had a general overview one pager on what CI is, and It had some statistics in it. Do we want to distribute that to people just so that they can cite some of those things when they're describing what CI is all about if the staffer is unfamiliar?
Sure, we can easily do that, so that you have it in hand, and if somebody wants it, obviously we can send it to them as well. So we'd be happy to do that. I think we just actually revised it, so there's an even better version than the one you saw before. So we'll send that on to you.
Great. All right, well, I think I'm handling this last slide. This is the last slide we have here. Just some wrap up points. Education is the key to these meetings. We're advocating, but we're really trying to educate the staff about this whole issue area and some of the key issues that come to mind. The good thing about this, believe it or not, is that the three issues we're dealing with are not particularly complex. You should see when we've got to go in and make a really difficult argument with a group of people coming in. These are pretty non-controversial and strongly supported views or positions or policies. So we're hopeful that we'll be able to get some good meetings and convey the message. Again, I noted earlier, the staff are very young. They're very busy. Try to play, read the room. I'd be clear, we have to be clear on our requests, but the team leaders will make sure that we remind people of that. We can't just talk about the issue and then move on. We have to actually ask them for something. Please sign on to this House sign-on letter or communicate to Congress on your own if you're meeting with a Senate staffer. Please co-sponsor the EHDI bill in the Senate. And if you're in the House, please pass this bill, get this thing done by the end of the year, and thank them for passing it in December. And then please extend telehealth so that when the PHE ends, people who need audiology and speech language pathology services don't lose access to telerehab. Those are the three messages. Follow-up is going to be critical. We'd like to, we'll definitely follow up with some thank you notes, but typically the constituent who is represented in that particular meeting, meaning if you're from Michigan, we're meeting with a Michigan congressperson, should send a thank you note and just appreciate your time. Hope you're you're willing to follow up and sign on to these letters and endorse this legislation and establish that connection. Make sure that they have at the end of every meeting, we should offer ourselves as a resource to them whenever they come across a hearing health issue or a CI issue. Please reach out to me. You should say, and ultimately we'll send a more formal thank you that gets to everyone so that no one feels as though we didn't follow up. If there's an outstanding question you can't answer, there's no problem saying, I don't know the answer to that question, and your team leader will help negotiate that, and we can get back to them. We can follow up. It actually provides a great opportunity for follow-up later down the line. And that's pretty much it. It's a lot of fun after the first meeting. If you've never done this before, you'll be nervous for the first meeting. After the first meeting, it'll run very smoothly.
They are humans too.
That's right.
I have a
Barbara?
quick question about the thank you notes. Does it matter if it's electronic versus handwritten?
I wouldn't bother with the handwritten. They'll send that through scanners and all kinds of. It'll take 3 weeks to get there. Just send a nice email and make sure that you attach your signature block so they know who you are and how to get in touch with you. Make reference to the ACI Alliance meeting that you just held, that you just had with them, and we can maybe even send around kind of a template thank you note that could facilitate those thank you notes later next week after the fly-in. Anything else? All right, well, we're at 8:05. We have this taped. If you are really not sure about this, you want to listen to this tape again, it'll be re-aired, I guess, next week. And we will not be doing this live again early next week on the 2nd, but it's still available to you. And then, of course, the morning of, we'll reorient everyone, try to get you plugged back in and clear out the cobwebs, and everyone will hopefully have a clear understanding of what the issues are and how to go about doing this. And then again, as the day goes on, you'll realize, hey, this isn't so tough. I mean, you're in this field, you understand the issues. It's their obligation to listen to their constituents, and I think you'll have a really nice day, and I'm looking forward to a real productive day. So thank you all so much. Let me turn this back to Donna. Any parting comments, Donna?
I don't. I think you guys did a really great job. And thanks very much for preparing so thoroughly and getting us all ready and happy and confident about moving forward. So I think they're going to do a great job.
Very briefly, I'm sorry, very briefly, I see that Joe Nara has joined, and Joe is a colleague. He's on by phone only. He's feeling a little under the weather today, but he will be around and be one of the team leaders next week. Donna's going to be a team leader. Nicole will be a team leader, and Taryn Kocher, who I mentioned earlier, along with Michaela and myself, will all be team leaders. So we'll be, you'll see us again, and we'll be trying to help you through this. But again, we're really counting on you to do the talking and to talk about your story, and to we can help with like the request or the ask or answering questions that might be a little bit far afield from what your knowledge base is, but you guys are really there to talk about the substance. So take a look at the one-pagers, review the slide deck again, and let's go in and have some effective meetings.
All right, thank you, everybody. Again, if there's any issues that come up, I know they said to contact Emily and Michaela, but please do also contact me so we can help close the loop on a lot of these things. And all of the information packets, I will send it out in an email to everyone as well, including a wrap-up form for you all to fill out after each meeting, so we have a very clear idea about who we met with and what people's impressions were of the meeting.
One last thing, Nicole. Please don't get worried if you don't have calendar invitations in your calendar and here it's coming the day before. I expect those to go out the day before. So don't expect them until the 3rd. And they might be amended slightly the morning of the 4th. So just continue to block out that 10 to 4 time frame. And the calendar invites will come from Emily Goodwin, and they'll appear in your calendar, and you'll know what your schedule is the day before. Okay?
So will they come by email?
Yep.
They'll be sent by email, but if your email is linked to your calendar, which mine is, and I think most people's are, no, it's not.
My email's personal, but if I change to my work email, yes, it
Okay.
would be.
Well, you'll get it in your email, whatever email we have for you, and just take those and transfer them into your calendar in such a way that you can click on the link and it will bring you to the Zoom meeting. And they'll all be from Emily Goodwin. So if you find one, you'll find them all just by going to the from Emily Goodwin, and you'll have them all lined up.
Okay, thank you.
Okay. Be a little bit flexible that morning because sometimes schedules change last minute. Keep an eye on your email, especially from Emily. And if you do have problems, let Emily know and we'll factor that in. I think we're done.
Thank you, everybody. Have a good night.
Thank
Have a good
you.
evening.
Bye
Thank
now.
you. Good night.